My name is McMaster, and this is my blood draw. First, I will apply the tourniquet. Make sure I have my gloves on. I will then take an alcohol wipe. Start where I'm going to draw the blood. Do a circular motion about a couple inches out. I'm not going to wave my hand or blow dry. I'm going to let it dry by itself. That way alcohol doesn't get through the vein. Then what I will do is I will find my needle. I will take the cap off. Once this is dry, I will kind of hold the skin taut above and below. I will feel for the vein, make sure it's squishy, and I know where I'm going. I will insert at about a 30-degree angle. Once I have it in, I will add in the vacutainer. And I will hold this in place so I don't hurt the patient or cause any movement. Insert the blood tubing. Let it get filled. Depending on how many of these I will do. I will turn this about 8 times. Same with this one. Then I will take off the tourniquet. Hold some pressure. Take this off. I would then cap my needle to make sure it will not hurt when I throw it in the sharps container. I will then apply gauze. I will put some tape over it and make sure they apply pressure to lessen any bleeding. Alright, this is my IV. First, I'll make sure I have all of my IV start kit, my needle, my flush, the blood tubing or IV tubing, and my tourniquet. I will flush this line into my kit just to make sure there's no air bubbles like that. And then I will just place it back over there to make sure. I will then initial and date the sticker on the dressing just to make sure the next nurse or I can keep track of when it was first done. And also if there's a change of that sort throughout the shift. All right, I will first feel for a vein. I'll make sure there's not enough valves or bumps. I'll make sure it's not over a bone. And I will then put the tourniquet on. I'll make sure it's not too tight. Once the tourniquet is on, I will get my floor prep. I will snap. Let all the water run to the bottom, the chlor prep run to the bottom. I'll then go to where I am going to insert. Just like the blood draw, I will prep a couple inches out. And again, I will not blow on it. I will not wave my hand. I will let it dry completely by itself. Then I will get my needle. I will then anchor the vein above and below, just so it stays in place. I will also go in at about a 30-degree angle. And I go all the way down to the hub. Once I know that I am in and I am good, I will then push this to retract the needle back so I can dispose of that into the sharps. I will then get my tubing, and after I do that, before I get my tubing, I will then take my tourniquet off. Then I will grab the tubing. I will hook up the tubing. Add a little bit of flush, and then I can also draw back, make sure I am in. I got some blood, so then I will take this off. I can put a little bit of gauze under to give it a little bit of a pillow in between the skin. I will then take one of my pieces of tape and I will tape the tubing down just so it can stay in place while I add the dressing. Then next I will get my dressing. I will put my dressing right over where it was inserted. But I do not want to cover where the blood tubing starts, just in case I need new tubing if it becomes occluded. I will then take this offsite off, make sure it is down. I will then grab another piece of tape if needed, just to securely make sure to securely put that down. Then I will take the tubing, when it's usually long enough, I'm not going to wrap it around, and then secure it as well. And then I will go to the nurse's station and I will document everything that I did, what size gauge, and all of that sort. Then I will also make sure I add this sticker with my initials and date to keep track. Lastly, I will be doing a central line dressing change. Before I even begin, I will make sure my patient has a mask on. Anyone in the room will have a mask on. I will have a mask on, and if the family doesn't want to put on a mask, they can leave the room and wait until I am done. I will then get my package. I will open it sterilely. I'll open my gloves, make sure those are ready for when I'm done. Taking the dressing off. First, I'll be taking the old dressing off. I will make sure to hold where it is inserted into the skin with one hand, and then I will peel back the current dressing from the bottom to top. So if it does maneuver the IV in any way, it will go into the vein instead of coming back out and then having to restart all over. Once that is done, I will take these gloves off. I will throw them away. I will then grab my sterile gloves. Once I put my sterile gloves on, which are one size fit all, I will be ready to start. I'll make sure I have everything that I need. Get my gauze ready. I will initial and date my dressing so the next nurse knows when it occurred. And then first I will get my, I think this, yep, perfect. I will get my prep stick. I'll make sure I have 2 of them. I will then scrub all around the site, make sure it is nice and clean, get any debris that had been maybe left over. Then I will go grab a second one. I will then take the tubing and I will clean the tubing as well. And I will definitely start at the skin and then work my way up to the end of the tubing. I will then discard that. And once that is dry, I will add gauze in between the skin and the tubing just for more comfort. I will then use another skin prep, which is different, and then I will make a window around where the dressing is going to be sticking to. So both sides horizontally and vertically. I will discard that. I will then grab my dressing and I will place over it. I'll then take this off. I would remove that. Doesn't want to come off, unfortunately, sorry. But I would make sure I take all this off. There we go. There we go. All right. Then I will take the part where I initial and date. I will place that on the patient where the dressing is. Then I will take some tape and then I will put it on the tubing to stabilize that as well, and any other areas that I feel would be necessary for more stabilization. I will then go to the nursing station. I will document everything that I did, the supplies that I use, and I also document what the patient's site looked like before I changed the dressing.